Tuesday morning, July 29th. And right now we are joined by Dr. Andrew Carlone from Center for Sports Medicine and Orthopedics. Dr. Carlone, how are you?
I'm doing very well. Thank you for having me again, Bridget.
Yes, of course. We're glad to have you here. So Dr. Carlone is a fellowship-trained, board-certified total joint surgeon who brings a wealth of experience and a deep commitment to patient-centered care to the Center for Sports Medicine and Orthopedics. Dr. Carlone is invested in providing patients with high-quality, evidence-based care and is committed to helping them return to the activities they love. He has specialty training in complex primary total hip and knee replacement, revision total hip and knee replacement, direct anterior total hip replacement, and partial knee replacement. So this morning our topic is going to be anterior hip replacement. So Dr. Carlone, what makes anterior hip replacement different from the traditional approaches?
Well, with anterior hip replacement, we do it differently than with the posterior approach that most folks have been used to over the past 40 years that we've been doing a lot of hip replacement. So with the anterior hip replacement, rather than making the incision on the back or on the side, we do it directly in the front. And what we do is we are able to go between the muscle planes and we don't cut any muscle. So there's a smaller incision, less blood loss, there's less tissue damage, and also less pain, which is very helpful in the recovery process for the patients.
Yeah, so I was going to ask, is recovery faster with anterior hip replacement?
Yes, ma'am. Absolutely. So especially, when we look at the studies of anterior versus posterior hip replacement, at about 3 months, most patients are at the same place in terms of functional and pain levels. But the big difference with the anterior approach is in that first 2 and 6 weeks. And so over 50% of my patients walk in without a cane or any assisted devices at 2 weeks after an anterior approach. They're able to push up faster out of a chair, and so it really helps with the recovery process by not violating those muscles.
We're talking with Dr. Andrew Carlone, Center for Sports Medicine and Orthopedics. So will someone have movement restrictions after surgery?
So I don't do any sort of restrictions after anterior approach hip surgery, and I tell all of my patients, listen to your body. If your body's telling you that you're not ready to do a certain movement or a certain activity, then listen to your body. But in terms of bending over, not crossing your legs, all of those positions are actually positions of safety after an anterior approach, which makes it much easier.
So who is a candidate for anterior hip replacement?
Well, most patients are candidates for anterior hip replacements. We can do those on patients of all ages, all sizes. Ultimately, it comes down to making certain that the patient is healthy and safe enough to undergo an elective surgery.
We're talking with Dr. Andrew Carlone, Center for Sports Medicine and Orthopedics. Are there any risks or complications with this surgery?
Certainly. Just like any other surgery, there's always risks of complications. Overall, with the anterior approach hip replacements become a very routine surgery. We do, there's hundreds of thousands of these done across the country every year with a very low complication rate. In particular, with hip replacement, one of the biggest risks is infection, just like any other surgery. But then, particular to hip replacement is what's called a dislocation, where the ball pops out of the socket, which is not great. Now, with an anterior approach, the risk of that is significantly lower than with a posterior approach. And in fact, in over 1,500 hip replacement surgeries, I've had 0 dislocations.
Wow. So how long will the new hip last?
So the current data is showing a very high rate at 20 years of hips remaining in place. And so what that means is that we think that there's a lot of surgeons that think that the days of hip wear are gone. And so we're expecting these to last 30 or 40 years. But I just don't I tell patients that I just don't have 30 or 40 year inpatient data to tell them how long it'll last. But there's about a 97% retention rate at 20 years with very little wear.
That's Dr. Andrew Carlone, Center for Sports Medicine and Orthopedics. What is the best way for people to get in touch with you and schedule an appointment?
So if they call Center for Sports Medicine, I'm in the Cleveland office, and be happy to evaluate any patient with hip pain and any other orthopedic problems. And if a patient's a candidate for a hip replacement, we'll get them a great new hip and help improve their quality of life.
That's Dr. Andrew Carlone, Center for Sports Medicine and Orthopedics, right here in Cleveland, online sportmed.com. Doctor, great to see you. Thanks for coming in.
Great to see you, Bridget. Thanks for having me again.
All righty. It is 7:23. Let's get a local news update.
The Mix 104.1 News.